It has been a long time since I've recorded this, so I'm back. Today's topic is going to be the healthcare Amazon. I'll briefly go over what this healthcare Amazon is all about, and I will simplify it for you folks. Okay, let's do it. The healthcare Amazon is a deductible health plan with a health savings accounts. It's a consumer driven healthcare. Yes, it is a consumer driven healthcare. America spends $3.8 trillion in 2019, still ranked 37th. It is simply not acceptable. We could be number one. Healthcare is very complicated. I'll make it simple for you. They make it deliberately complicated. Healthcare is when you receive the care from doctors and hospitals, whereas health insurance is how you finance it and how you pay for the care. That's as simple as your premiums are not based among the risks among the similar groups. Consumers are powerless. Insurance restricts them. Cost and quality is hidden. And ideally, the premium should be based on risk segmentation, well category, at risk category, chronic illness category, catastrophic category. Chronic illness are only 15% folks. They consume, their claims are 50%. Who are the main stakeholders, you may ask? Consumers, uninsured, doctors, insurers, and employers. We'll go one by one and I'll go into detail. Consumers, what do they want? They want coverage for the pre existing conditions, increased choice, improved quality, and lower premiums. Yes, lower premiums. What does the uninsured want? You got it, folks. They want a guaranteed access to affordable coverage. This is where we need to focus on. People are uninsured, economically deprived, and they have illness. What does the doctors want? Tort reform with a cap on malpractice claims. They want to practice less in defensive medicine. What do the hospitals want? They want to they want to minimize the uncompensated care. What do the insurers want? Stabilize the private insurance market, folks. Expand the client base and more product offerings. That's what they want. More product offerings. What do the employers want? Affordable group insurance. And the workman's comp should include health insurance. Why not? We need to modify and include the health insurance. It is a win-win for employers and employees under the healthcare Amazon umbrella. Employers get to get tax savings, workers get deductible health savings with health savings accounts for their families. What is Health Review Authority? It is a public-private partnership, folks. Public-private partnership monitors the insurers and denied applicants are reviewed and issues a guaranteed certificate of guaranteed coverage. These billings, the cost of the billing, medical billing is enormous, folks. It's more than 20 to 30% because of the administrative, even in the managed care, middlemen, 20% administrative. Do we really need all this billing? We can pay as we go. Consumers' health insurance includes guaranteed, some popular items like guaranteed issue of insurance, coverage of the pre existing conditions, dependent children coverage, and comprehensive major medical. What is this consumer's choice to save? When you participate, employer contributions are pre-tax, they get write off, and consumers pay voluntary contributions. It's a win-win for employer and employee. And you pay as you go through this debit card, folks. Yes, you pay as you go with these debit cards. And that's well, and what are the government programs? Government programs nothing but creates bureaucracy. Look at Medicare, Medicaid, Veteran Health System, TRICARE. They are bureaucratic machine. It increases the cost and is not efficient. Technology is on the consumer side, folks. Technology favors the consumer. Telehealth and look at this. I'll give you a simple example. Capsule endoscopy. It totally eradicates the invasive procedure where you can look inside. So what is it? In conclusion, the consumers doctors feels that empowers the consumers, technology favors the consumer, and government role is to facilitate the quality, and consumer demands affordability, competition, and transparency, folks. This is what they are looking for. This is what is all about the healthcare Amazon, or you may call it as dollarcare.org, which is a non-profit organization, will try to facilitate the healthcare. It is representing you folks. It wants to, under the nonprofit umbrella, it wants to empower the consumers, not insurers. If you want to keep listening to these topics, follow me. Follow the Consumers Doctors channel. We will see you in the next episode of Consumers Doctor. Goodbye. God bless.